Hello, and welcome to LA IVF Clinic's podcast series, Understanding Your Fertility, a podcast series specially curated to answer all your questions about fertility, with fertility specialist Dr. Aykut Bayrak, and I am your host, Ara Behagan. Today's episode will be a two-part series. We wanted to discuss the multiple variations of IVF treatment that have become popular lately. So today we will discuss specifically natural IVF and talk about how that compares with traditional IVF. Also, make sure you subscribe to our podcast. You will be notified when part 2 of the series comes out next week, where we will be discussing something called mini IVF, or sometimes referred to as minimal stem IVF. We really hope this information helps to better inform your decisions if and when you seek fertility treatments, and hope you enjoy this episode. Hello, Dr. Bayrak. Thanks for joining me today.
Hi, Arba.
So I'm excited about today's topic because it's been something that I've been increasingly curious about, which is a fertility treatment called natural IVF. Now, when I heard this term, I got excited because I thought, well, great, natural is better than unnatural. So given a choice, I'd rather do natural IVF. And my assumption is that natural means IVF treatments without medications. That's my guess. And which also would mean that I wouldn't have to suffer through any of the side effects of hormonal medications. So I'm thinking, why isn't natural IVF offered to everyone? So Dr. Bayrak, can you start us out by clearly defining what natural IVF is and even why the word natural is used?
Yes, so natural cycle IVF is an interesting term, right? So when you do IVF, there's nothing natural about that. Obviously,
Right.
we're doing a lot of things in the laboratory. So that's kind of an interesting oxymoron there, right? So the natural IVF really should be unstimulated IVF. So IVF without ovarian stimulation would be a longer, but probably much more of an appropriate term. So no medication IVF would be natural IVF. But when we do IVF, obviously that's not natural conception. We're still doing a lot of things in the laboratory. Right. So it's kind of, kind of a funny term there. But so natural IVF has been around for many years. So it's been around for such a long time. And it has been kind of coming and going in waves in our subspecialty. It somewhat becomes popular during an era, and then it becomes unpopular in a way. So, but recently, it has been once again quite popular, and that really relates to that natural part of IVF. And we all live in an era where we want to eat, healthy and organic and more kind of go back to doing things that are less related to interventions or pharmaceuticals. So we're kind of living that era where we're more leaning towards more natural type of treatments, homeopathic approaches, mind and body kind of balancing. So all of those, I think, really prompted the natural cycle IVF or natural IVF to become popular again, even though this is not something new.
Okay.
It did not, it's been around for a long time.
So, can I stop you here and ask you, you mentioned that natural IVF is IVF without ovulation stimulation.
Right. So no medication IVF should be the corrected terminology as opposed to natural IVF.
So let's compare then what regular IVF is compared to natural. So when you do stimulate, what do you mean by the medications and what is happening when you
Right. So conventional IVF or traditional IVF, it refers to taking hormone injections for about 7 to 10 days in order to develop multiple eggs in the ovaries. Or in other words, stimulate the ovaries so you can have multiple mature eggs. Then you fertilize them in the laboratory. You do in vitro fertilization, right, in the laboratory, and you create multiple embryos. Then you grow those multiple embryos. You either test them for chromosomal problems or you transfer them and freeze them. So that's conventional IVF. And the benefit of conventional IVF is it gives you more than one chance. It gives you more than one option compared to natural cycle IVF, where you only have one shot. You only have one egg, maybe one embryo, maybe one transfer. So with the conventional IVF, you're using injectable medications, hormones. So the cost is higher, certainly, because depending on where you live, in certain states or countries, IVF may not be covered. So you're paying extra for those medications. In this country, in the US, the medications are very expensive, and almost all except one are still brand names. So there are no generics, right? So what that means is the cost of the medication might be at times half to 1/3 of the whole IVF cycle, which is dramatic. So when you do natural cycle IVF, you're not taking any medications at all and allowing the body to select the egg of the month, which normally it would, and follow that egg to a certain point where it reaches a certain size, certain maturity level, where it releases a certain amount of estrogen hormone, which then will be defined as being mature egg. And at that time, that egg can be aspirated from the ovaries and then can be fertilized in the laboratory. So then we would do IVF with one egg, right? So the tricky part of this is that, number one, natural cycle IVF is unpredictable. Sometimes the egg will grow just way too fast and you'll miss it. Sometimes you see the egg and you try to aspirate it and you put the needle into the ovary, you do an egg retrieval procedure and you don't get the egg. And sometimes you do get the egg, but it doesn't get fertilized. Or sometimes it does get fertilized, but it doesn't grow. And sometimes it does grow, but it doesn't implant. So you have multiple stop signs along the way, which you always do, but you only got one shot. You only got one egg, maybe one embryo, maybe one transfer, and there are no alternatives. So that's why natural cycle IVF compared to conventional IVF is highly limited. So who's appropriate for natural cycle IVF is, I think, what you're going to ask me. I can see it. I can see that's coming up. I can see, yes. My sixth sense tells me that you're going to ask me that question. So who needs to do natural cycle IVF? Well, first of all, anybody can do natural cycle IVF, right? So if you're 21 or you're 41 or you're 51, you have a lot of eggs, you don't have a lot of eggs, or there's sperm problems, or the tubes are blocked. So anybody can do natural cycle IVF. It is indicated for everybody. Now, who is it appropriate for is probably the better question to ask, because then you can identify those individuals who would benefit the most from natural cycle IVF by eliminating cost and other issues and maybe risks that you would take with conventional IVF and still expect a similar pregnancy rate per try, per attempt, per cycle, per month, right? So in general, for majority of the patients, conventional IVF is better for many, many reasons, because we are working with multiple eggs, we're creating multiple embryos, we have a lot of chances. Somebody wants more than one child, you can freeze those embryos, or you transfer the embryo and that person is not pregnant, then you have backup embryos. You just undergo a transfer in a subsequent cycle, right? So you can test the embryos, you can freeze them, you can wait. So you have a lot of kind of luxury in a way when you do conventional IVF. So who is the appropriate candidate for natural cycle IVF? So if you are in a way in the two extreme poles in a way, or sides of your reproductive potential. And what I mean by that is Let's take two patients as examples, because I think sometimes when we talk over these examples, it becomes easier to understand.
Right.
So let's take a 22-year-old patient, woman, who's overall healthy, who has a boyfriend, husband, partner, who has normal sperm. Her egg reserve is really good, and she's 22. But she had a really bad pelvic infection in the past, and her tubes were infected. And eventually her tubes were removed, where she just doesn't have any tubes, which means that she has to conceive in the laboratory because she cannot fertilize the eggs in her fallopian tubes. So that person is a good candidate for natural cycle IVF because everything is working other than the tubes. Because there's great sperm, there are good eggs, and everything else should be working perfectly. So that person can undergo natural cycle IVF because even if you get one egg from a 22-year-old, most likely that egg is going to be healthy. Most likely it's going to get fertilized. Most likely it's going to grow into an embryo. Most likely it's going to implant. And most likely it's not going to result in a miscarriage, but rather a live birth. So, right. So that person is a good candidate for natural cycle IVF. So that's on one kind of extreme, I guess, of what we're talking about.
Okay.
Let's also fast forward and take a 46-year-old patient, female woman, who is trying to conceive. And she does all the testing, and her tubes are open, her uterus is healthy, husband's sperm is perfectly normal, she's very healthy, active, but she's 46. And just because of her reproductive age, she has lost a lot of her eggs. She does conventional IVF, right? Because her doctor says, well, you should do conventional IVF because your chances are higher, significant. And because her egg reserve is so low, she only gets one or two eggs. She does that again, and they change the protocol, and they still have the same outcome. Well, in that particular case, no matter what we do, we're only getting one or two eggs. So that particular patient is an excellent candidate for natural cycle IVF. Because whether she uses drugs or not, or stimulate the ovaries or not, she is getting one or two eggs, which is the same as natural cycle IVF. So why are we going to give all these hormones and injections and this kind of intense therapy for some patient, some person where they're still going to develop one egg on a natural cycle, right? So that person is also an excellent candidate for natural cycle IVF. So in my opinion, both of these examples are, I think, explaining to us that there are certain patients, individuals who are really excellent candidates for natural cycle IVF. Now, if we have a 43-year-old or 33-year-old who wants to do natural cycle IVF, is the answer no? Not really. But the answer is, well, if you do natural cycle IVF, only get one egg, or you do conventional IVF and you get 10 eggs, your chances with natural cycle IVF are significantly lower, which then necessitate multiple egg retrievals,
Right.
multiple procedures,
Right.
which in itself can be risky.
Yes. And
so,
costly as well. So,
and costly.
Right.
Exactly. So every time we do a procedure, there's a small risk. If you do one or two procedures with conventional IVF versus we do 5 or 10 natural IVF cycles and do 5 or 10 procedures, well, natural cycle IVF becomes riskier. Right? So it's all about, how we approach and how you kind of present and understand it. So the risk may be higher with natural IVF if you're doing 10 egg retrievals versus you do only one with a conventional IVF because you may just reach that goal of getting multiple eggs or embryos. So all depends on the patient, and that's why we always talk about individualizing the care. But for the most part, if you compare conventional IVF to natural cycle IVF, conventional IVF always comes on top.
So I think also the term natural, I mean, that's very helpful to understand who's a great candidate and who wouldn't be. And I think that leaves still a good majority of patients that come through fertility clinics who then still do conventional IVF. Because you talked about two very extremes on one side and the other. And so the majority of everybody else sounds like they're doing conventional. So what about the fact that, as far as the medications are concerned, it's a big concern out there that, the rumors of what it takes to go through IVF medications sounds pretty dramatic. And if I go on social media, I see pictures of needles around kind of like a heart shape, just showing how many needles it took to eventually conceive. And so I think the sentiment is that we're all trying to avoid these medications. What are the risks behind the IVF medications itself?
So that's a common question.
Yeah.
So IVF medications typically come in the form of injectable hormones, although we have some pills that we use as well. Most of the time we use injections so we can get a good number of mature eggs. Well, the hormones are going to make you feel as if you're pregnant initially, even though you're not pregnant yet, as you are preparing to create embryos. That's one side effect. Mood swings can certainly be significant in some individuals, not everybody. And by the way, not everybody has side effects, obviously. Headaches while on either birth control pills or hormone pills or injections, that's one side effect. Well, you're also putting a needle into your body, into your lower abdomen. I mean, who wants to do that every night for 10 days, right? So that brings a certain amount of stress. And the injection's coming up every night, right? So after a long day, when you get home, the last thing you want probably is to put a needle into your body, right? So there's that kind of anxiety and stress that's associated with that. But certainly, I think what I've found in practice over the years is that educating the patient is probably the most important thing, and preparing them for what's coming up, I truly believe alleviates all the anxiety and the side effects. So that's, I think, very important. In terms of long-term side effects, a long time ago, people used to think that fertility drugs increase the risk of cancer and so forth. But many, many studies looked at that over the years, and it doesn't appear to be that way. It's also important to limit the number of IVF cycles and medication dose and so forth. I think that goes without saying. In terms of the risks of medications such as creating multiple pregnancies and other side effects, those issues used to be in the past, where doctors used to put back 2, 3, 4, 5 embryos in the past. So it is, quite rare to put in more than one embryo in our practice. I mean, we do put sometimes 2. We have done that in the recent past, but only if the embryos are really not healthy at all or not great quality. So sometimes, we talk about, natural cycle IVF, you're putting in 1, so you're minimizing the risk of twins, triplets. Well, in the conventional IVF, we also put back 1. Gotcha. So that doesn't change.
So the medication itself isn't what's causing multiple, causing twins or multiple babies.
It's not. It's the number of embryos that you put into the uterus that increases or decreases the risk of having twins or triplets. So in the past, when we compared natural cycle versus IVF, let's go back 20 years ago, I had the same discussion. I think back then we would have said, well, natural cycle IVF results in a singleton, whereas majority of the time conventional IVF results in twins and sometimes triplets. As of today, as we're doing this podcast in 2021 now, there's no difference between 2 because we're only putting back 1 embryo, no matter what type of IVF you do anyway.
And then with conventional IVF, the medications, does it affect the egg itself? Does it affect the eventual embryo?
That's an excellent question, Araba, and a valid question. So once again, over the last 15, 20 years, people argued that conventional IVF and that hormonal environment would actually make the eggs bad or worse. Meaning, if you have the body select the best egg of that month, as opposed to growing multiple eggs that month, which a natural egg would have been selected from, with these hormones or that hormonal environment, are you making those eggs unhealthy? Meaning, if you grow 2 eggs versus 8, is that different? Getting 2 eggs, is that better than getting 8 eggs? So if you increase the quantity, does the quality go down? And this has been a discussion for many years. And most people said, well, when you stimulate, you get so many eggs that you have bad quality eggs. And that is actually not true, because we actually have good medical evidence from donor cycles. We have donors who have been hyperstimulated. We have donors who have been just normally, as expected, stimulated. And we also have donors who were not stimulated in a sense that they had very few eggs at the end of the cycle. And when you look at the recipients of those donated eggs, which are then turned into embryos, the pregnancy rates are actually exactly the same. So if you get one embryo out of 40 eggs or 20 eggs or 10 eggs, as long as that egg is good and it's fertilized and it's an embryo, the pregnancy rate is the same, which then tells us that stimulation and getting excessive eggs or minimum number of eggs or more eggs doesn't really impact the health of that embryo. Now, there is a flip side to that. If you are stimulating your own body and your ovaries, forget about donor eggs, and you're going to carry the pregnancy yourself. Now, if you're hyper or overstimulated for some reason during a conventional IVF cycle where your estrogen level is very high and you are somewhat uncomfortable because you just have so many eggs, that is a separate issue where freezing those embryos and transferring them in a subsequent cycle, in a frozen embryo transfer cycle, is better than what we call a quote unquote fresh embryo transfer cycle. But that is a different situation that is related to the environment inside the uterus, but not the ovaries. Gotcha. And that is sometimes a confusing subject. Just this morning, actually, one of my patients' husband asked this very question. And he said, well, should we just get 1 or 2 eggs? And would that be better than 8 or 10? So I had the same answer to that individual this morning. So, yeah.
And so just to clarify for listeners as well, so you mentioned donor eggs. You mentioned, you're saying donor because from donors, they're cleared as completely healthy, no fertility issues. And that's why you compare donor eggs, meaning the healthy set, versus somebody with infertility. So when you're looking, you were mentioning that as far as when you're comparing this study between donor eggs? Right?
No, not really. What we're comparing here is the environment that you're growing the egg. So the question is, if I get 2 eggs from one person in one cycle, and then I stimulate her and I get 8 eggs from that same person in another cycle, the 2 eggs that I got were not as aggressively stimulated. Are the chances of those 2 eggs being normal greater than the 8 eggs that I stimulated? So the best way to study that is to separate the environment and the variable related to the egg compared to the environment where implantation takes place, which is the uterus.
Oh, I see what
So
you're
the recipients
saying.
are not growing eggs in this instance, but rather simply receiving these embryos.
Gotcha. Okay.
So then you're controlling for the environment on one side, and controlling for the environment that the eggs are growing in another person's body in a way. And that's how you remove the bias for the purpose of the study.
Gotcha.
So it's more important that way rather than, growing eggs or over hyperstimulating within the same person.
Well, that's super helpful to understand that difference. Okay. So it sounds to me that in many cases, conventional IVF is definitely, you have better chance of getting more eggs for the one cycle that the one egg retrieval that you do, and you have a better chance because you have more eggs, and you have a better chance of you can create more embryos from that one egg retrieval cycle. And then that means you have a better chance of, so let's say you do PGT, which is another topic, but you have a better chance of those embryos being healthy, or at least one of those embryos being healthy out of that batch. But if you just do one with natural IVF, you only have one chance.
Right, exactly. So, I mean, in a way, IVF and reproduction is a numbers game. So, men ejaculate on average at least about 15 to 20 million sperm
Wow.
per milliliter
Whew.
per ejaculate.
Wow.
Right.
That's
So
incredible.
why are we ejaculating that many? Right. So it's a numbers game because they're not all good.
Mhm.
So the production unit called the
Mhm.
testicle is going to produce so many sperm, but they're not all going to be healthy. Same thing with the eggs.
Mhm.
Even though we're releasing one egg per month,
Mhm.
the ovaries provide us a group of eggs 5, 10, 15, 20, up to 50, depending on age. So why are we being offered so many eggs where we only need one egg?
Mhm.
So once again, because it's a numbers game.
Mhm.
So the more eggs we have, the better chance that we're going to have more good quality eggs.
Mhm.
Same thing with the sperm. The more sperm we have, the more good quality sperm
Mhm.
that we're going to get from that ejaculate or from the batch of eggs that are growing within that month.
Mhm.
And by the way, when you do conventional IVF, if there's an issue with the egg quality or somebody's at age 38 or 40,
Mhm.
majority of the eggs are going to be abnormal.
Mhm.
So it's not like all the eggs that
Right.
we grow are normal.
Right.
And that's why you're trying to increase the quantity
Mhm.
to increase the number of good quality
Mhm.
eggs and embryos.
Mhm.
So that's where conventional IVF becomes more helpful. But that doesn't mean that we should not or cannot do natural
Mhm.
cycle IVF.
Right.
It's just that we have to counsel the patients
Mhm.
so that they clearly understand the difference, which is, I
Mhm.
think, one reason why we're doing this podcast, so people can listen and say,
Mhm.
oh, wait a minute, I think I am a good candidate for natural cycle IVF,
Mhm.
or, oh, you know what, I'm not a good candidate for IVF,
Mhm.
natural cycle IVF, because I have a decent egg reserve and I want to have 3 kids,
Mhm.
right? So I think that will be really helpful for somebody to understand. But natural cycle IVF is, I think, a great
Mhm.
approach for some women, some
Mhm.
couples, but not all.
Mhm. Great. That's fantastic, Dr. Byrek. I appreciate you taking the time and explaining that and clarifying what natural cycle really means. It's such an elusive, broad term that it's. I think there's a lot of different ideas floating out there about what it really means exactly. So I'm glad you were helped to clarify that for us.
Right. And natural cycle IVF doesn't make any sense, right? Because it's not natural.
I know,
There's nothing natural about
exactly.
IVF, right? So I'm going to
Right.
think tonight, and I'm going to try to change that.
Yeah, we need a new
We're
word.
going to have to
new term
invent.
for that.
We have to say unstimulated IVF cycle
There
or
you go,
something.
there
So
you
it
go.
sounds, but natural sinus sounds better.
It just
It's more attractive that way.
Yeah, it sounds better.
Well, why don't we just keep it as natural? What do you
Okay,
think?
I think natural is good.
Let's keep it as
It's good.
natural for now, until further notice.
Right. Okay, and to our listeners, you can find out more about Dr. Byrek and LAIVF by visiting our website at www.laivfclinic.com or follow us on Instagram and Facebook at LAIVF Clinic. And thank you for listening. Understanding Your Fertility is created by LAIVF. Please note that this podcast is intended for a broad understanding of the topics presented. It does not substitute for the medical advice or care of a physician-patient relationship. Podcast listeners should always consult with their healthcare provider regarding any medical condition that requires professional attention. Follow us on Facebook, Instagram, and Twitter. If the information on this podcast